angiogram, and Anders Grützing done the first angioplasty in 1968. So this was the first picture of the coronary angiogram in which right coronary artery is, you can see it is being cannulated. So what is coronary angiogram? It's basically a radiographic visualization of coronary arteries after injection of radio opaque contrast media. So what we do, we get the access to the coronary artery through a peripheral artery, that is most of the time femoral artery. Another another pathways are radial artery and ulnar artery, sometimes brachial also. So after entering the artery, we go into the sinus of valsalva of the aortic root. There are two osteas, left and right. From left, there are two arteries, left anterior descending and left circumflex. And from right coronary ostia, there is right coronary arteries. So after entering into the aorta to ascending aorta and aortic root through catheters, we take shoots under fluoroscopy guidance. So X-ray, video X-ray, you can say, that is called fluoroscopy, and we see whether we inject a dye and we see what uh, how the coronaries are filling, where is the defect, where the contrast is not moving. Accordingly, we decide what is the lesion in the coronary arteries, and we decide the treatment also. So, there are various patients who come to our OPD or hospitals. To which patient we have to do coronary angiography is a very good and vast topic. Based on that, there are various.
Coronary angiography is the gold standard test to visualize the blood vessels supplying your heart. It helps identify blockages responsible for chest pain or heart attacks. During the procedure, contrast dye is injected through a thin catheter, allowing real-time X-ray imaging to reveal the exact location and severity of arterial narrowing. Early diagnosis through coronary angiography enables timely treatment such as angioplasty or bypass surgery, helping prevent major cardiac complications and saving lives.
So radial approach, we use 0.035-inch guidewire. These are non-traumatic J-tip wires. So after taking puncture, the guide wire is introduced into the radial artery, and on the guide wire we introduce the sheath through which the catheter goes into the coronary arteries. So catheters with guide wire inserted in ascending aorta. The catheter lumen filled with contrast, and we have to look for alteration in tip pressures. So there should not be any air after you cannulated the after you go into the ascending aorta and aortic root. You have to make sure you have to back bleed the whole system so that there should not be any air. And after back bleeding, you have to fill the lumen of the catheter with contrast. So there it should have a airtight. The whole system should be airtight before putting the contrast in the coronary arteries. So the fall in overall catheter tip pressure is called damping, and a fall in diastolic pressure is called ventricularization. So we have to make sure that once you take the invasive arterial monitoring of the from the aorta, it should not damp. Like aortic pressure, if suppose is 140, once you cannulate the coronary artery, the systolic pressure should not dip down. Once this systolic pressure dips down, it is means damping, and it means there is certain stenosis or a spasm of the arteries at that time. The ventricularization, that is the diastolic pressure decreases because of when the catheter goes into the left ventricle. So if the pressures are ventricularizing, we have to be very sure where what is the site of the catheters. If it is into the ventricles, then you have to take it out and recannulate.
During coronary angiography, always observe the pressure waveform carefully. A normal arterial waveform confirms proper catheter positioning and uninterrupted coronary blood flow. Damping of the pressure waveform indicates partial obstruction of coronary blood flow by the catheter. Immediate catheter repositioning is essential to prevent ischemia.
Ventricularization occurs when the pressure tracing resembles a left ventricular waveform, indicating deep catheter engagement. Recognize this sign early and disengage the catheter.